been the current chair for Women United through Cedar Valley United Way. Along with me today, Jacqueline Heller will be taking over as the chair of Women United. So we'll kick this off and do an introduction. We're excited you're here. This is a topic that's important to all of us. It's important to the community, and we're really glad you could spend the time today to learn more about what we can do to support mental health in our community. This event will be recorded, so just a public service announcement that this will be recorded. So a little bit about Women United. We ignite change. We tackle the issues that matter most to people. We empower other women to use our passions, our ideas, our expertise, and resources to transform the conditions in which people live. We don't stand by. We're raising our voices, rolling up our sleeves, and establishing a legacy of change that benefits everyone. We ignite the power of women who bring the passion, expertise, and resources needed to get things done to create lasting change in our communities.
Yes, thank you, Allison. Again, I'm Jacqueline Heller, and I'm with KWWL in sales, and I'll be taking over as chair after this meeting. We believe at the Women United, our communities need champions who understand these problems, see the potential for change, and will offer tangible solutions that will make a difference. By joining Women United, you'll become part of a community of like-minded women who contribute their personal passions, inspired ideas, and unique strengths to the mission of building thriving communities.
Membership is open to women who are at an annual giving level of $1,000 to Cedar Valley United Way or $500 for those 40 and younger. Giving can be done on an individual basis or through a combined household giving. Members can choose to participate solely through their giving or through their giving and volunteering on projects, which you'll hear more about today.
And just so everyone knows, this committee started as an endeavor of the Cedar Valley United Way in 2008. This group strives to increase contributions to the Cedar Valley United Way.
Over the last year, we've certainly changed how we've done our events. This is our first virtual event, so we're excited to have you. The timing with May being Mental Health Awareness Month is perfect, so we're really excited about this. Some past events we've brought in some really fantastic professional speakers to focus on education, including Ruby Payne talking about bridges out of poverty. We had Kathleen Kennedy Townsend come and talk about so many interesting experiences in her life and how she's used her passion to change communities and organizations. We've also several years done Wine with a Purpose, where we've provided donations to funded partners. We've done clothing drives, and a fashion show was our last event in 2019 at Dillard's. So if it's something that's exciting to you, please reach out. We're always looking to expand the board and come up with new ideas to engage the community.
And one of the major initiatives of the Women United Committee is the Women to Women mentoring program at Hawkeye Community College. This program is awesome because we partner professional women with non-traditional students and help guide them with resources in both professionally and personally to help them succeed. We've had close to 200 women go through the program the past 10 years. And this past year has been a little challenging being virtually. Nancy Henderson of Hawkeye Community College, I'm assuming she's on today, is awesome, and she's been coordinating. And then Krista Olson and Hannah Stovall and I have been working together to coordinate mentors and mentees. We finished out the year with 10 mentees, but we're really hoping in the fall when students are back on campus that we can get a big kickoff and get a bunch more mentees to start the next year.
The mentoring has really been just a fantastic program. I've been a mentor, and I always learn more, I think, probably than my mentees. So it is a great way to get involved as well. I would like to announce our current board members: Jill Miha of the Isle Casino, Nancy Henderson of Hawkeye, Susie Hines of John Deere and Cedar Falls School Board, Krista Olson of John Deere, and from United Way, we have Holly Dusenberry, Samantha Meyer, and Sheila Baird all provide us tremendous support to put on events like this.
Yes, they have been awesome. We also want to thank our sponsors for the event. The first 50 people who signed up for the event today received a Chick-fil-A gift card, a Tri-Pie gift card, and also Scooter's Coffee gift card, as well as some fuzzy slippers. Please support these businesses as they really care about impacting women in the community as well as mental health. So shout out to them. So now I will introduce our MC of the panel, my friend Abby Turpin. For those of you who don't know Abby, she is the evening news anchor at KWWL and is executive producer for the 5, 6, and 10, as well as being a nighttime anchor. She is super involved in the community. She's been with the station, 4 years now?
Yeah, 4 years on June 13th. Yeah.
I thought that was coming up.
Yeah.
And she is been an anchor broadcasting for several years. Before that, she worked in the music entertainment industry, very talented. And she has a wonderful husband, Travis, and a beautiful daughter, Reese, who are swimming right now.
Yes, they're swimming. So the house is quiet. So they had to go do something. Well, thank you so much, Jacqueline. Hi, everyone. It's truly a pleasure to be the moderator for today's event, a very important discussion we're going to be having. As you all know, May is Mental Health Awareness Month, and mental health has been a growing issue in the world today. And today we're going to hear from 5 professionals in the community about this topic. So right now I'm going to introduce them. Please welcome Alyssa Fruchtenicht. She is a licensed independent social worker and manager of behavioral health services at Blackhawk Grundy Mental Health Center. We also have Troy Belmer. He is sales manager for Gordon Flesch Company and co-founder of Alive and Running Iowa. Lindsay Stack is a licensed mental health counselor, certified EMDR therapist, and certified alcohol and drug abuse counselor with Pathways Behavioral Services. We also have Brooke Hollohan. She is the family support and wellness case manager at House of Hope. And then Pam Delagardelle. She is the president and CEO of UnityPoint Health, Waterloo. So welcome to all of our panelists. Right now, I'd like to start out to have each of our panelists explain their why and take about 2 minutes to do this. And we'll go ahead and begin with Pam.
Thank you very much for the invitation today. And I just really want to start by doing a shout out to Women United. Thank you for all your contributions to the community. My why is pretty simple. Grew up in the Cedar Valley and have a passion for the people who live and work here. I am a nurse. I actually don't remember a day not wanting to be a nurse. My mother was a nurse too, and had great experiences as a nurse. However, as I went into college, it never occurred to me that mental health would be something that I would ever be interested in or involved in. As a matter of fact, I had a really bad clinical experience as a student in mental health. And so, had determined that that wasn't something that was ever going to impact me. I don't know if I really needed to know it other than the care of the entire patient. And so I went on to get married to my husband, Rick, and we had 5 children, 5 healthy children that live and work in the greater Cedar Valley. And as I began my job, it will be going on 9 years ago at Allen Hospital, the one thing that was very concerning to me was my ability to really wrap my head around running the service line or supporting the service line in my role for mental health. So our mental health unit, had some challenges and really needed some special attention. We have great people that work here, but, had some difficult patient, issues. And so I expressed concern to the board as they were interviewing me about that, but decided, the best way to learn is to jump in and figure it out. And it wasn't within really weeks of being in my job that I had the opportunity to experience a mental health crisis up close and personal. So a family member, I didn't expect that, we would ever have to worry or think about that while there were people, around us that, that had experiences with suicide or mental health. That wasn't ever something that our family was ever going to have to deal with. My husband and I both come from very stoic German families, and we don't talk about mental health in our families. And, we don't have mental health issues. And so we were very much part of that average stigma that you see, even as a mental health professional. I stand before you and say, I just plain didn't get it until, we had that up close experience. And I'm really pleased to say, that individual in our family is really a very productive, high performing mother, career individual now. But I can say that when we were struck by this issue, we learned firsthand. My why is about learning firsthand the lack of availability and affordability and accessibility of mental health services when you're in crisis. And so here I stood as a new CEO for a large major employee of, a healthcare organization. I had a lot of relationships with the psychiatrists, the staff, people that, I could, access. We had good insurance, but there were no services that were available to us. And so a lot of our grief and a lot of our anxiety around this situation was not being able to get this individual and our family the help that they needed at the time. And so it was shortly after that I was invited to be a co-chair for the United Way campaign. And I made it my platform. So Tony DiCecchio and I were co-chairs, and I really made it my platform to bring mental health awareness. So being really open about my lack of awareness and understanding, but also embracing and owning the lack of accessibility of services. And so I am beyond passionate about trying to use, whatever resources that I have available to making sure that the Cedar Valley is better served by mental health services, and trying, to innovate and be, a person who can help remove barriers to those services for other families. And so back to you, Abby.
All right, Pam, thank you so much. All right, Brooke, please tell us your why. I think you're on mute, Brooke. Let's see.
Got it.
There
Better? Technology. So I want to piggyback off of Pam and just say thank you for the invitation. And I'm so glad that we're having this discussion and that people are interested in growing the accessibility to mental health services in the community. My why, geez, I've been passionate about serving families and advocating for kids since, for over 20 years, and really have had a hard time choosing which focus, and just see the overlap between child advocacy, prevention of child abuse and neglect, and mental health services and resources. So I've really felt that when we can provide more mental health services to everybody in our community, it is the win. We need to tackle both the stigma for receiving mental health services and the accessibility part for all populations. So I've really been passionate about the vulnerable populations in our community and those that have some really a lot of systemic barriers. And so how can we go out and serve others in the community? And kind of like Pam said too, I've been in a situation with extended family and walked alongside them as they've tried to access mental health services, and I've struggled to help them access services, and I'm in the field. So how must other families that maybe either have a stigma or just have a lot of other barriers of transportation or generational poverty, like how must that be for them if we struggle and we're actually in the field? So
Brooke, thank you so much. We're really glad you're here. Lindsay, what is your why?
Yeah, thank you for having me. And I'm so excited that there's so many people that signed up for this event, because I think probably all of us are very passionate about the work that we do. You can't be very effective in this field unless you have that passion for the people. And so I kind of came about working in this field in a roundabout way. I originally was very interested in becoming a graphic designer and a journalist, surprisingly enough, and that's where my past life was at. And I soon kind of realized, that maybe I wasn't meant to just be creating graphics on a computer all day. I was very much a people person. I enjoyed talking with people, meeting people, getting to know people. And At about the same time, I had a family event as well. So I think most of us in the field have some sort of personal experience that has just kind of increased our passion for the work that we do. I had a family member who was struggling with drug addiction, co-occurring mental illness, had struggled for years kind of secretly and had shared it with me. Had gone to treatment, had gotten help, and had started to turn his life around. And I just remember thinking in that moment, how wonderful that there was at least one person, if not a whole team of people, that were able to do that for my family member, my loved one. And how that resonated with me as something that I just wanted to do. I wanted to learn more about it. I wanted to do that. And so, you know, years later, after going to grad school and then starting out in the field, my first position was at Horizons, which is with Mercy One's treatment center, working on the inpatient unit. And I just knew that that was where I was meant to be. I loved it. I loved working with people, being empathetic with people that oftentimes didn't get that a lot in their day-to-day life. Just being able to see a person for who they really are as a person and not just the symptoms that they presented with, which can oftentimes be what the focus is on. And so as I moved over to Pathways and started working here, it just kind of enhanced the, you know, that mission that I was on. I've gotten to have a lot of different experiences here, whether it's gambling addiction, substance addiction, mental illness, worked with a little bit of all of it. And I've just really loved living in this community. So that's kind of my why, is just to help people remember that they are inherently good people and they deserve to have a good life. And not everyone is maybe able to see that or help with that, but you know, being able to connect with resources and help people is why I do what I do.
All right, Lindsay, thank you very much. Again, we're really glad you're here. And now we'll go to Troy. What is your why?
I'd like to say it's a privilege and a pleasure to be on this panel today. So thank you for those that made that possible. My why is pretty simple. When I was 15 years old, it was a long time ago, a very good friend of mine took his life by suicide. And another very good friend of mine was actually the one who found him. And it was by gunshot. So it was not a pleasurable thing for him to see. And losing Roger was bad in itself, but then to watch how Ryan deteriorated over the years from having found him the way that he did. So that led us to forming Alive and Running. Ryan is my partner in that. And, you know, when we started that, it was similar to what a lot of you have already said. There was nothing out here for it. So we started that event to raise funds. You know, we're not mental health professionals. We're just a couple of small town guys that like helping people. So we started that organization, and we've been able to do a lot in the community to help offset the funding that's not available. And we've done projects with every organization we've been talking about, Unity and Mercy and Blackhawk Grundy and Cedar Valley Hospice on the grief side. And so the passion really is just helping other people, and so that no one else has to go through, you know, what we did as teenagers and as adults, to watch how it affected someone who found somebody in that situation. So again, it's a pleasure to be here. I'm looking forward to the rest of the program. So thank you.
All right, Troy, thank you very much. And finally, Alyssa.
Thank you. I appreciate the opportunity to be a part of this panel. My why, really, I think back to, I started my career working with young children and their families and helping to address how mental health impacts the family system. And being able to be providing those interventions and seeing those outcomes, and transitioning to school-based mental health and outpatient therapy here at the Mental Health Center, and seeing those systems of care and the value of providing that care and being a difference, being able to support individuals in some of their toughest days and their toughest times really is impactful. And being able to spread awareness about mental health and mental illness to increase partnerships and access to care really is a lot of what's behind my why and wanting to have a healthy community and healthy families and healthy adults. And so they have resources that they know how to access and can access and have timely access to care.
All right, Alyssa, thank you very much. So now we will go ahead and begin our question and answer session. I have a list of questions. In essence of time, I've kind of assigned who's going to answer each question. A couple of you will answer each one. But panelists, if there's a certain question that you're not called on, but you would like to weigh in on, please feel free to jump in. We really want this to be a good discussion. We don't have to get through all of my questions. We just want everybody to feel that they are saying what they want to say today to help the issue of mental health. So we'll get started with question number one, and that is, how has mental health been affected during the pandemic? And I wanted to start with Lindsay on this. You're a certified alcohol and drug abuse counselor, and we know that those abuses have increased during the pandemic. So if you could go ahead and talk a little bit about that.
Yeah, certainly. I guess when I was first thinking about that question too, my initial response was, how hasn't it been affected by the pandemic? I think all of us can probably, speak to that a little bit, whether we were remote, schooling our children at home and working from home at the same time and the stress that that's caused. But I think all of those things, so the isolation piece, the kind of prolonged trauma of what we've been experiencing globally, the with isolation often comes some depression, and a lot of people, I think we've all probably seen the memes and the funny Facebook posts about, mom needs a drink today after homeschooling the kids, or, so a lot of times that stuff is perceived to be, a funny joke and haha, we all laugh about it, but there have been a lot of people that have either increased their substance use or have developed substance use issues during this time, because I know we've talked even just within our organization about the number, how much alcohol sales have skyrocketed over the last year and a half. So, when you can't go anywhere, you can't get out, you're stuck at home, what's there to do, right? So whether it's drinking or other substance use, a lot of people tend to, if we have difficulty, if we have fear of going out to a doctor or a therapist, or don't have access to those services, we tend to revert to what we know works. And so sometimes that becomes substances to kind of self-medicate. So what we've noticed is that, people have continued to have problems, some of which have become a lot worse, but then with kind of the lack of being able to come into the office to see people, it was about being able to reach out. And I am so grateful that we've been able to do telehealth services during this time. In fact, it's actually been something that I hope continues, because it's removed some barriers to being able to access services. We've been able to reach more people in rural areas that would have a lot further to drive to get to therapy or to a medication appointment. But overall, I would say just depression, anxiety, we're seeing an increase in that, more people requesting services. So we've been very busy lately, and I don't see that changing anytime soon.
All right, Troy, kind of wanted you to touch upon with Alive and Running Iowa, maybe explain a little bit more about the exact work you guys do, and then also what you've seen during the pandemic.
Okay. As far as Alive and Running and what we do, we host a lot of different events throughout the year, community education events. Ryan, who's my co-founder in this, does not work full-time, so he has a lot more time to do things, but he's a certified QPR trainer and certified in assist. And he has done, in the last year, I think he's up around 55 different QPR trainings, several assist trainings. So a lot of our work is on education in the community. We do our big fundraiser every year is we have a 5K run walk that's held in Dunkerton on Father's Day weekend. That's what we started with. That was the initial year was 2010, and that's the only thing we did. The next year and every year since then, we've made it a 2-day event. So Friday night is a very emotional remembrance ceremony where we remember those that are lost. We have a guest speaker. It's where a lot of people come pick up their packets and stuff ahead of that. And then Saturday is followed by the 5K. And I always tell people to really get the full feel of what Alive and Running is, you really need to attend both events. I related a lot to a funeral, for example. A lot of times the wake or the visitation is extremely emotional. You haven't maybe seen this family in a while. It's the first time you've seen them since they lost their loved one. And usually those evenings are very emotional, whereas sometimes the funerals actually seem to be a little more relaxed because, you know, we're starting to remember the good things and you see a little more laughter and smiles at a funeral. And that's exactly what happens at our event. Friday night is very raw. It's very emotional. And Saturday, I don't know if it's the fact that they're walking and running and they're, you know, endorphins are up, but the mood on Saturday is more, how is this positively impacting versus, you know, what has been a negative impact of that. And that's our large fundraiser. So then we take those funds, and then every year I reach out to the different organizations in the Cedar Valley and ask for a wish list. You know, how can we help you financially? We're very big about, if we give money to an organization, we want it to go to a specific thing. We've been asked a lot over the years, how are we able to raise so much money? And I think it's our transparency with our followers and with our community of where that money goes. You know, we've done huge furniture projects with Unity, with Mercy One. You know, we've started 2 different support groups that meet every single month for survivors of suicide loss. One is run by Cedar Valley Hospice. We have a partnership with them. The other one, we sent a trainer to get trained to be a facilitator, and that one meets in Waverly. You know, we have billboards that are up all around the community 365 days a year. Again, we do a lot of education opportunities. So I think community members see that and they know that the money is actually going to specific things. You know, Blackhawk, Grundy Mental Health, Tom's always done a very good job of giving us a list, you know, go buy these things. These are things we need. And that's where that's at. As far as your second question, how has it impacted? I'll say positively. Lindsay mentioned this, but telehealth has been huge. I mean, the fact that, you know, there was laws changed as far as how the compensation goes, and just people that have trouble getting, you know, appointments. I know that just from sitting on other boards that percentage is way up through telehealth because it eliminates the transportation problem, timing, all of that stuff, maybe just the fear of leaving the house. Negatively, I 100% believe the isolation has been hard on a lot of people. When it first started, you know, being a person that's been in sales for 27 years and being out in the public, it was very difficult. You know, I consider myself a very strong person when it comes to mental health. And, you know, our company made a decision to lock down our sales force and we worked from home. And it even started to wear on me to the point of I need to get out of here. I need to see people. I need to be back in my element. And I think you've seen that with so many people. I tend to relate it a little bit to, if you think about crime, and one of the biggest fears of that is you're going to go to jail. You're going to get locked into a room and you're going to stay there. And that is such a deterrent for people to not get in trouble. I don't want to go to jail. I don't want to be in prison. I don't want to be confined in one space. And it happened to everybody in this country. So isolation is something that most people fear, and it happened. And I think it tested even the strongest people. So thank you.
Yeah, Troy, thank you very much. All right, and Pam, how have you seen mental health affected during the pandemic?
Well, I think of myself as a relatively optimistic person, but I have to acknowledge Troy. I've been asked a lot, how has the pandemic impacted mental health, but it's never occurred to me that it has had a positive, you know, that positives have come out of it, and the telehealth and some of the new funding and the acknowledgement about that certainly are. So thank you for, you know, for bringing that forward. You know, as you look at the pandemic, it's a shared event for all of us, but it's not a shared experience. So every single one of us has experienced the pandemic differently. And I think as a leader of a large business with 3,300 employees, I have had to dig deep to bring empathy about and really try to do everything I can to support our team members who are experiencing needing to work from home, or help their children with school at a time when we have been very, very busy in our business. In the early stages, so I would like to specifically talk about how the pandemic has impacted our workforce as caregivers and those who provide mental health services and support as well. During the very early stages of the pandemic, what we saw was this deep fear and anxiety as people watched what was happening out on the East Coast. So, this fear and anxiety about what was coming this way. Would they be exposed to COVID? Would they carry it home? For me, it was not sleeping for 2 straight weeks, worrying about I knew that we did not have the personal protective equipment in stores that we needed. I brought a good face to work and I said, we're going to take care of you. We're going to do everything we can. But in my heart, I knew we didn't. And it wasn't until the day that I received a call from Deere about the fact that they would be willing to donate goggles and masks, which they did for a lot of us providers. I think they did for Mercy One as well, that I was able to really engage and lead the team through the part of the pandemic. And so, we went through several phases with the pandemic. About midway through, we had a second and a third wave. And the second wave was in July, which is a time when people were really wanting to be off and be able to take their families or, just spend family time. And here we were deep in having 70, 80 COVID patients. So on a good day, we would normally have 120, 130 patients. There were many days during the pandemic that we had 70, 80, 88 patients in beds, along with, other people that had other illnesses or were having babies or were in our mental health unit. Interesting thing is that our ERs were just not busy at all. Nobody wanted to come to the hospital unless they absolutely had to. And so there was another group of people who were fearing, is my job going to come back? And people were being floated to areas that they were not, they had normally not worked in. And so we had quite a few number of people that just tapped out and said, I'm not doing this anymore. I'm leaving. And that kind of led us to that third wave back in November then, as we got close to Thanksgiving. And by this time, people were absolutely exhausted because, if they weren't working a 12, a 16, an 18-hour shift, we were calling them and begging them to come in. As a matter of fact, our senior leaders, who the majority of them are nurses, we worked alongside our staff on the floor because we were so understaffed during some of, the COVID. I think, we are seeing depression now too, because oftentimes our caregivers were the only people that were able to be next to those patients who are very anxious, unable to breathe, and who are dying, because of a lot of the concerns about passing on COVID. And so our staff now, as we're on the tail end of a lot of the hospitalizations, and COVID's not going away. We'll still have 7 or 8 patients every day in the hospital with COVID, and a number of them in our ICU. People are, they have PTSD. So, they have packed away a lot just to keep showing up to work. They've seen a lot of things that they cannot unsee. And I think the other thing is we're focused on giving vaccines now. And so there's such a large politicization of the vaccines that, a lot of my colleagues, they're angry. They're angry about people saying that they won't get the vaccines when we've been so overwhelmed by trying to care for really sick people. So the number one concern that I have, my colleagues in our system have, and our new CEO, is really the resilience and the well-being of our staff going forward following the pandemic. So we are putting enormous resources into trying to support people. And I'm grateful to, our panelists, every single one of you who are providing support services, even to our own team of caregivers. And I just share a personal story. I really compartmentalized a lot of what I saw and what it was exposed to during the pandemic. And so 2 weeks ago, I found myself being snappy with, staff members, depressed. And really good friends, said, well, what is going on with you? And I realized that I needed to ask for help too. And so sought, help for really dealing with my experiences through the pandemic, and really feeling a lot better, have, started to exercise again, and, do all of those things that you need to do, to really help yourself get over something like this. So anyway, back to you, Abby.
Oh, thank you very much. Thanks, Pam. Okay, let's go on to the second question that I have. And this is, what are some of the best ways to reach out to young children and adolescents, especially teenagers, to erase the stigma of mental health in general? And I wanted to start with Brooke on this, because you work at House of Hope, and a great organization, as we all know, that helps homeless mothers and their children. So how do you reach out to the children that you see there?
There we go. So for young children, whenever I meet with the family when they first move in, I'll do an assessment and I'll visit with the mom. And a lot of moms or parents are unaware that young children experience a lot of stress as well, and can have some mental health concerns. Being homeless is traumatic in and of itself. So we talk about trauma. We talk about ways to support your kiddo while they're working through some things, and kind of how that safety and stability once they're at House of Hope, how that can then, once they're safe and stable, maybe some of those mental health symptoms will come up. And we talk about how they're doing in school, and then I provide a lot of resources for them to have some coping and healing at home and with the mom and in the community. So if they would like to access play therapy, or if they want to talk to a counselor or a family therapist, I would walk alongside of them. And same thing for the teenagers. If we're talking stigma, or if we're talking like, how do we speak with teenagers about mental health? A lot of times I just talk to them about how they're doing, like and we'll use the word like stress, or how it feels in their body. Because when we throw a label on something right away, there is a lot of kids, especially in families, that'll just shut the door right on that. So I'll talk to them a lot about like, do you feel really nervous? Is your belly, spinning in your belly? Is it hard to just get out of bed? Are you really tired? Or, so I'll talk more about the symptoms, and do you want to start feeling better? So what might that look like? And really just going slow especially with teenagers, not being pushy, asking and normalizing too. Like, this is really common. A lot of kids feel this way in different settings. So when we can normalize it, and then I explain how the brain works in some ways, like, I'll maybe equate the brain or mental health to diabetes or other conditions, and how it's all a spectrum. Like, we just need to talk more about it and see where you're at with it. I'm going to check back in with you. And I think adults being brave enough to ask some of those questions. I know as a parent myself of teenagers, sometimes it's hard to ask those questions if you're feeling depressed or anxious, because we're afraid of the answer that we're going to get. Like, how terrifying if your child is having thoughts of hurting themselves, or how terrifying, if you're a teenager doesn't really want to get out of bed in the morning, so, but sometimes we really have to be brave and ask those direct questions and leave space and give permission for them to talk about it with us.
Great, Brooke. Thank you very much. And now to Alyssa, kind of talk about the children you've come into contact with and how you've helped in erasing the stigma about mental illness.
Yeah. With Blackhawk Grundy Mental Health Center, we have school-based mental health therapists. So they are going out to the schools, meeting with students, and engaging their families in care at school during the school day. And we've really been able to provide education to the supportive adults in the lives of these young people to accept and have conversations about mental health and mental illness, to normalize and validate those feelings for those kids and adolescents and teenagers, but also to be able, among peer groups, to be able to have those conversations and to know what to do if a peer comes to you and expresses concerns. What do we do with that information? Where do we take it? And getting teenagers accurate information about mental health and mental illness and healthy coping can really be powerful. We see a lot of social media campaigns on Facebook and TikTok and, you know, all these kind of platforms that our teenagers are accessing that are giving information, but also being mindful of the accuracy of some of the information that teenagers are getting. We know that teenagers oftentimes will turn to each other in times of need. And so arming teenagers with how to help each other, arming the adults in their world with how to navigate if a teenager has brought something up, or if we recognize something in a child or an adolescent that we see as a concern or a change in behavior, an increased isolation, drop in grades, any of these pieces that have led us to say, you know, this teenager or this child seems to be struggling in ways that we feel like we want to get them connected to help. And so really validating, normalizing, giving access to resources, how do we access those resources, and having them be available and timely available, I think really makes a difference for those adolescents who maybe have fears and concerns. When we meet with teenagers for the first time, it's a lot of that, like, this is tough to come into these offices and share some of the stuff that you've been going through or that you're coping with, and really highlighting the courage in doing that, and how we can walk alongside them in that journey to finding wellness and healthier coping and processing something that they've experienced. And with that, I think then we in turn are helping other teenagers that are talking to them about this experience. I saw a mental health therapist and this was the great outcome. And so we're much more likely to increase and access care that way because we have made it okay to access that care and we've made it a standard part of that system.
All right, Alyssa, thank you very much. Troy, next to you, because you explained a bit ago that the reason that you co-founded Alive and Running Iowa, it's such a personal reason to you. Kind of talk a little bit more about why it's so important to educate the community about mental health.
I think it's important because education can be such a preventive tool. You know, we are big advocates of the QPR training. One, because it's short, it's simple, it's basically mental health first aid. Instead of learning CPR, you learn QPR. And for those of the people that have never been in it, it stands for question. How do you question a person? How do you persuade them? And how do you refer them? And it's really meant to be at that crisis point where someone is on that edge of, you know, do I see tomorrow? Do I not? And I hear so much feedback from people who attend that class. And recently we had a lady that they own their own business, and one of their young workers ended his life about a year ago. So she's been very involved in Alive and Running since then. And she's actually hosted a couple of QPR trainings because we provide them free of charge. I mean, it's part of our funds is we provide the books and the pamphlets and all that stuff for free. But she was just recently sharing with me that a friend of hers reached out about a person that she didn't know who was very suicidal, and Corey got involved and basically went right through the QPR steps and was able to get that person out of that frame of mind and in the hands of a mental health professional, and that person is still with us. And when you hear stories about that had she not attended that training, she would not have known what to do. It just makes me want to have everyone be in those classes. So that's why I think that education is so key. You know, with losing Roger at such a young age, when it happened, you know, of course, we're just floored. You know, we had no idea that it was going to happen. But then when you look back in retrospect, that guy left us so many warning signs that we just didn't pick up on. You know, we're 15-year-old boys not paying attention to that. But I guess I'll give a couple of examples that I've shared when I've spoken schools about this is, so he was a songwriter. He liked to write songs. And he'd bring them to school and pass them around the lunch table and that kind of stuff. And I remember one song that he brought, and he was passing around the table and a couple people hadn't looked at it. And he was like, hey, make sure you read this. And after he passed away, we found that letter in his room. And the song was basically, don't come crying when I'm gone. I mean, and it was a complete suicide note written in a song that none of us noticed. Other things that are warning signs that I didn't know at the time was, I remember being at his house and he had just gotten a bunch of new clothes, and it was like right before school picture day or whatever. And he had this really cool shirt that I thought was neat. And he's like, well, you can have it. And it still had tags on it and stuff. And I'm like, I can't take that. I said, your parents will be mad. You know, they just bought that. And he's like, it's not going to matter. I had no idea what he meant by that. And just so many warning signs throughout that, you know, obviously growing up in the 80s and 90s, you know, people made mixtapes, you know, that's how we made music for each other. Well, he passed away on a Monday night, Tuesday morning. I was with him the Saturday before we went bowling and out for pizza, and there was 4 guys in the car. And when we dropped, he had dropped this tape that night. And when we dropped him off, Chris, the guy that was driving, ejected it and was like, hey, don't forget to take your tape. And he's like, no, you keep it. And they argued back and forth. And finally, Roger threw it in the car and then walked into his house. So we listened to that tape after he passed away. And the songs on there were like, Show Me the Way by Styx, Knocking on Heaven's Door. I can't remember what some of the other, but every song on there had a hidden agenda to it, and we didn't see it. So again, it falls back to education. If we had known what to be looking for, he'd probably be sitting right next to me today. So it's vital that people understand that.
Troy. Pam, why is it important to you to educate the community about mental health?
I think knowledge is power. I mean, if people understand that mental illness is really a medical condition disrupting a person's thinking, feeling, mood, ability, the opportunity to relate to others in our daily function. And it's so common. It's important to educate because nearly 1 in 5 Americans at any given time are, you know, experiencing mental health symptoms and issues. And so much of that goes unreported or unknown or, you know, not dealt with. Mental health is treatable too, and there's no shame. There's no shame in, you know, seeking help. So most mental illnesses can be treated effectively with medication, therapy, diet, exercise, and support. Recovery is absolutely possible. So I don't think I could have said it better than Troy did, but you know, we just need to get more information and awareness out there for people.
Yeah, absolutely. Pam, thank you. Moving on to my next question. What are the most common types of mental health problems that we're seeing right now? And what is the typical treatment? We'll start with Alyssa on this.
We here at the Mental Health Center, and statistics show this as well, depression and anxiety in our adult population have really risen with the pandemic and in recent years. You know, recent data by the United States Census Bureau identified that in 2020, 42% of individuals who filled out the survey were feeling an increase in depression and anxiety. And that was compared to 11% in 2019. And so looking at how we've seen such an increase in depression and anxiety, with children and adolescents, we see ADHD, behavioral problems, and depression and anxiety as some of the primary diagnoses. Treatment planning around that are going to be a comprehensive assessment. What is it that's been going on? What's the frequency, intensity, and duration of these symptoms, this experience? What led someone to access care? And getting, you know, for kids and adolescents, a good developmental history is really important. What was their early childhood like, their early development and meeting milestones? What other family factors might be increasing or impacting this mental health concern? Where we will look at family history of other mental health needs, parent systems of coping, and what that will look like with adults. We also look at their upbringing, their support system, their frequency, intensity, and duration of their mental health symptoms and needs. And then we start to create treatment plans around that. What has been tried, what hasn't been tried, for how long have things been tried to help address this need, looking at history of hospitalization, consistency in maintaining and sustaining care, what's led to barriers to treatment, and really focusing on the whole individual. So we know we've got individuals that might have high social determinants of health, and maybe have multiple barriers that make it harder to consistently access care. So how do we create a wraparound team approach to addressing that? How do we get you resources for some basic needs? Because we know when we've got high social determinants of health, we disproportionately have higher rates of mental health concerns. So we really have to look at it as a team approach to how do we address the needs of this individual. So we create individualized treatment plans around their specific presenting concerns, not only mental health wise, but in other areas of their world, so that we can have outreach go to homes. We can have an IHH team involved. We can get you connected to med managers. If you've got a child that's struggling as well, we can get you connected with a therapist for your family systems. And so it's really looking at having a comprehensive background and presenting and need information to be able to effectively treatment plan, and then use our evidence-based interventions to wrap around that care and to provide effective interventions, whether it's TFCBT, TheraPlay, EMDR, looking at targeting those evidence-based interventions based upon the need of that individual.
Alyssa. Lindsay, I kind of wanted to ask you the same question, but also going along with that, like, what are some of the health effects that you see from prolonged, untreated anxiety and depression?
Sure. Yeah, and I would agree with everything that Alyssa said. Anxiety and depression would be the most commonly diagnosed issues. And so, if you honestly, a lot of medical concerns can be linked to mental health concerns. And that's one thing that we really try to educate our clients about too, and the community as a whole, is that they're totally linked together. There is very little separation between the two. When you are not doing well physically, you tend to develop some mental health symptoms, whether, I'm having I've been diagnosed with a chronic illness and it's forever going to change my life. And maybe that causes me to have some anxiety and depression symptoms, or vice versa. So when people come in and start telling us about, how they've been feeling emotionally, we're definitely wanting to look at the whole picture. What's going on with your physical health? Sometimes, digestive issues are really common, especially with people that have anxiety. There's links to cardiac events and stroke from something as simple as stress. Chronic prolonged stress and increased cortisol levels can really wreak havoc, all the way to the point of shutting down our internal organs if it gets bad enough. I've known people personally, actually somewhat recently. I had a family member who was hospitalized with acute pancreatitis, not because of drinking, but the providers could only link it to stress, the amount of stress that she's been under for the last at least couple of years. And so I think that understanding that is really important, and educating everybody about that, because we don't just want to, medicate the symptoms. We want to get to the root cause. Another mental illness that I see quite a bit in the trauma work that I do. Trauma has been a word that has been a hot topic in recent years, and especially with the pandemic as well. But trauma can be a lot of things. I think, generally speaking, there's this idea that trauma is, if I've experienced abuse of some kind, whether in childhood or in an intimate partner relationship, or, I'm a vet and experienced it overseas, or I, experienced trauma during a natural disaster. But trauma sometimes, so like a simple way I usually describe it is anything that overwhelms our brain's ability to cope. And so for young children, sometimes trauma is that my mom and dad got divorced. Or for adults, sometimes it's I lost the job that I've worked at for the last 30 years out of the blue, and I don't know what to do with myself now. Everything is just, I just don't know what to do. And depending on how resilient a person is, if they don't have a lot of those positive things, that can really cause some significant issues. And so all of that together, I would say, is kind of, what we're looking at. And then as far as treating it, wanting to address it all together, because if you just pick apart one piece, which I think, years back, everything was very separate. in our state, in a lot of ways, mental health, and I'll use my example of mental health and substance use. Those are still separately funded in terms of services and treatment. And that can be kind of frustrating sometimes in terms of accessing services and resources. And so just this kind of sense that we want to be able to bring that all together so that people understand that there really isn't any separation, and that we do have to, take a look at everything that is going on, their environment, like Alyssa was saying, the history, the family history, what's going on. So I have clients that come in all the time and they, this is my presenting problem, and we get to the root of it. And it's really kind of, it all started back when they were really young, and so we want to know all of those things so that we can really address it from the root.
All right, thanks, Lindsay.
Mhm.
Brooke, at House of Hope, you see many different situations in the women that you serve. So tell us how you're able to connect with all of them with the right support for them specifically, mental health wise.
Yeah, so again, we meet with all the women and we really just try to do, a history, try to ask, have them share their story with us and share how they're feeling, share what they identify as a need, so if when I'm meeting with one of the moms, if they come to me and they share kind of how they're feeling or their stress level or their coping or their support system, and then we offer up resources and connections in the community. And I really try to be a bridge to some of those resources, understanding that I could just give somebody a card to a therapist. I'm not really doing a great service there, right? Like, I need to educate what resources are available, what therapy looks like, what it will look like going into that office, how they're going to get there. Are they going to have childcare? So I really try to be real specific about what a process would be to get help, to get some mental health resource help, and really open it up and empower a woman to say, it's on your time. Like, how are you feeling now? And is it at a point where you're like, I need to feel better. I want to feel better so I can be a better mom. Like, I need to address these mental health concerns because I'm not being the kind of mom I want to be to my kiddos. And a lot of times it's I'm putting my phone on speakerphone and we're making the call together, and helping provide, a volunteer can provide childcare or something like that. So really setting it up so that mental health services are actually accessible. I mean, more accessible than just, I can get an appointment. Like, what does that, like, true accessibility look like to somebody that's needing the resources? A lot of our women that have aged out of foster care in our Pillars program, when they come in and they'll meet with me and they are like, I am off meds, I am not seeing a therapist, I was forced to do this for 18 years, I just came from Brentwood or this group home, and I meet them where they're at. I'm like, all right, I get it. Okay, so I'm here for you. Here are some strategies, here are some coping skills that have worked for other people, what works for you in the past, how can we support you with what you identify as healing and support, what's going to work for you. And I'm going to keep checking in with you. And I'm going to keep saying, okay, how are things feeling? They're worse today. You're crying more. You can't get out of bed. Would you like to see what it would look like to get help? Like, would you like to make this call together? And really kind of empower them at their own pace and really point out, okay, you do deserve to feel better too. Like, normalize the mental health, normalize the symptoms, and say, by the way, you do deserve to feel better and to accomplish some of your goals. And it sounds like this keeps getting in the way of you feeling better and of you doing life. So really try to just empower and walk alongside so that they can fully access the resources in our community.
All right, thank you, Brooke. Troy, what are some suggestions that you have for talking about suicide with people that are having some major issues right now?
I think you treat it like you would anything else. I mean, we talk about the stigma tied around mental health, and it's been placed there, and you have to remove it. So I always relate mental health is no different than physical health. If you saw a friend fall down, you would go pick them up. Or if you saw someone who broke a leg in a football game, you would take them to a doctor. You have to have the same approach with mental health. You can't be afraid to be in that that vulnerable spot where maybe they're not real happy with you at the time because you're wanting to get them help, you're wanting to get them in front of a mental health professional. But we as people just have to treat mental health the same as we do physical health, whether it's having an open conversation and not skirting around the issue. I think it was Mayo Clinic put out a video. It's awesome. You can find it on YouTube, but it interviewed a bunch of adolescents and asked, what do you want to hear when you're struggling and what do you not want to hear? And quite frankly, if you watch that little short video, what they don't want to hear is what people most commonly say to them. And a lot of it is they just want people to be very frank with them. Like, I know that you're struggling. This is what I'm seeing. We need to talk about this. And if you treat it the same as you would physical health. So I think it was Lindsay earlier talking about like substance abuse. You know, if you saw a friend that was starting to abuse cigarettes more or narcotics or alcohol, you would sit and have a conversation with them. So if you have a friend that is starting to deteriorate mentally, whether it's you're kind of read between the lines on a social media post or you're seeing that they're withdrawing, just very early intervention to start having that conversation of what is going on here. You know, you're not the same person that you were before. So it's a great question. I think you just treat it the same as you would physical health and don't shy away from it.
Thank you, Troy. Pam, could you go ahead and speak on the work that is actually being done trying to increase access to mental health here in the Cedar Valley?
Absolutely. So we are doing a lot around seeking grants for expanding mental health services. So there are great partners with regard to providing those mental health services and substance abuse services. But we are looking to open up a mental health walk-in clinic adjacent to our emergency department. So kind of like an urgent care for mental illness or mental wellness. There are lots of good partnerships, and I want to take this opportunity to thank the United Way for all of the ways that they have funded a lot of our mental health partners and really understood how important it is to support this. So access is one of our biggest challenges in the Cedar Valley. We do a community health needs assessment every 3 years, and for over the last decade, mental health, access to mental health services in the Cedar Valley is the #1 issue that Mercy One, People's Community Health Clinic, Blackhawk Grundy Mental Health, and UnityPoint Health Allen Hospital identify. And so we have a responsibility to work to try to cover those needs and create that access.
All right, thank you, Pam. And also, Alyssa, I wanted you to touch on this. What's being done as far as increasing mental health services at Blackhawk Grundy Mental Health Center?
Yeah, like Pam said, writing grants, looking at funding opportunities to increase our access of care. In recent years, we've really expanded the locations in which we provide and offer mental health services. So expanding our school-based mental health program. When I first started, we had 4 school-based mental health therapists and we have 10. Increasing access on the psychiatry and the prescribing end. We've got more nurse practitioners now than what we did when I first started. We now have a therapist that goes out to the Waterloo Women's Center for Change. We have a therapist out at Hawkeye Community College. We're looking at integrating therapists into primary care clinics. So really expanding, but not just expanding here at our location, but expanding access to where patients are comfortable in accessing their care and are accessing their care so that they can have comprehensive care provided and a location that is familiar, comfortable, and accessible to them.
So thank you. Kind of turning to, I mean, we've talked so much about the stigma behind mental health and mental health illness. And what is some advice that you would give to someone who is just afraid to reach out? Again, you've all touched upon people in your lives that they're nervous to do anything because, again, of that stigma. So what advice do you give to those people? Lindsay?
Yeah, I often have people from the community that will contact me, and usually that's some of the advice or information I'm giving over the phone about how to approach somebody sometimes, but just even what to expect. I think that, you know, surprisingly, I mean, to me, this is still kind of a shock sometimes, but I still have people every once in a while that come in and they're afraid that if they tell me that they are having thoughts of hurting themselves, that I'm going to directly ship them off to the psych ward, and they're going to be put in a straitjacket and they're going to be locked away. And I'm not kidding when I say that. I mean, people still have that idea of what that looks like. And so being able to just talk to them about, just even coming and talking with someone. I don't even say, come and have an evaluation so that we can figure out what's wrong with you. I don't talk to them like that. Just trying to make it normal. We just want to sit down and chat and see if there's anything that we can do to help out, because, a lot of this stuff that's going on right now in the world is pretty crazy for all of us. And so just trying to kind of meet them where they're at or connect with them on like a shared goal. But as far as, even clients coming in and maybe being hesitant to participate in services, just reminding them that it's all driven by them. I mean, this is about you. This is for you. We are just there to walk alongside you and offer any sort of help that we can or information that we can. So if you tell me that you want to work on these goals and these people over here think you should work on these goals, guess what? We're going to work on the goals that you want to work on, because it's about you. And so I think people just understanding that they are in control, that we're just kind of there to help support is really important. And so I try to emphasize that.
Kind of going along with that, Lindsay, have you come across individuals who actually don't believe that anxiety and depression are real medical conditions?
I haven't had as many people that have had that issue, which to me is a good sign. It means that we've made some progress in terms of educating the public at large that, anxiety and depression are real illnesses and a lot of people deal with them. I think it's, I kind of say the same thing about substance use, because there still is a lot of stigma associated with that. And I said, I challenge anybody here today, or just anybody that I would pass in the street, to tell me that you don't know a single person that deals with a mental illness or a substance use disorder. And I don't think I would probably ever meet anybody that could honestly say that. And so I think I think that's good, though, that we are making progress with that education piece and people acknowledging that it is a real issue. Every once in a while, I would say there are some people that, maybe think that a person is attention seeking or maybe just lazy. I hear that sometimes with people that are suffering from depression, if their depression's bad enough and they, are calling into work, or they can't get out of bed, or, maybe haven't been taking care of their personal hygiene. And so, you'll get some of those comments or the stigma associated with that. But I don't know that I've ever had anybody just flat out tell me that they don't believe depression and anxiety are real. So I think that's good. Like I said, that we're getting somewhere.
Yeah, making strides for sure. Brooke, what's some advice you would give to someone who's afraid to reach out?
Yeah, kind of what the panel's talked about in the past or tonight. I would talk a little bit about how it's comparable to some physical ailments. I talk a lot, especially the teenagers I work with, about the chemicals in your brain and that we're all in a spectrum. Normalize the symptoms, and really I'll share, like, if things are moving slower, what like lack of motivation is. It's not lazy, kind of like Lindsay said. I think there is a fair number that will say, oh, they just, they're just feeling lazy, or they just don't want to do anything, and it's kind of their choice. So I'll really try to relate it to the physiology of what's going on in the brain, and share, like, we'd never say to a kid with diabetes, just pull yourself up and eat better. Instead, you don't need that insulin, so I'll try to compare it to some other physical ailments and normalize it. And really also share with them that they are in the driver's seat. If they want to, and if they do see a therapist, like, and it's not a great fit, no one's going to force you to go again. And I like the comment about, like, you're being taken away to the, to the psych ward. I've had the same, experiences with clients where they're like, that's what they're afraid of. That's their vision. So really to share, like, hey, you can go see somebody and never go back. You can go see a provider and they might prescribe medicine, and we'll actually role play this in my office sometimes because they're so afraid that they're going to be forced to do something or forced to take something. And like say no thank you, say I don't want to take meds today, but I want to learn about something else. And so really just kind of empower them and walk them through the details of what treatment looks like and normalize, and we'll pull up some stats I've pulled up on my computer, like, okay, let's see what the symptoms are here. What are you feeling, and just so they can see how common, unfortunately, mental illness is and how many people need support at some time in their lives. And I'll also share too, like, this doesn't mean that you're going to struggle with this at this level for the rest of your life. Like sometimes this is a bump in the road, it's a hiccup in our brain. We might need a little bit of help right now, and then you might be better. Like this might be just a season in your life, but we need to address how you're feeling. You need to feel better. You get to feel better.
Brooke, thank you. So besides, a barrier like just being afraid to seek help, what are some other of the most common barriers that you guys see in seeking treatment? Pam?
Well, I think it's the stigma, really, and I think we have to destigmatize mental health, and I think that we do that best through conversation. And so we have a responsibility to make it okay, really, to talk about mental health services. I think other barriers that that we have is we have people that cannot afford mental health services. Of course, we've talked about the accessibility. We've talked about the lack of mental health professionals. We have transportation issues. There are a broad range of reasons that people do not have access to mental health services.
And Alyssa, would you like to weigh on that and on that as well?
Pam really touched on a lot of those components that we see that impact someone's access to care. And so really creating systems that help address that access to care, to provide those resources that aid a patient in getting connected to services, reaching out, having conversations, and really addressing those social determinants of health, the other factors that are impacting whether they follow through or feel comfortable or have the resources to be able to follow through with treatment, and really putting treatment in locations that are accessible to them, so that we're not having long drives. Telehealth has really impacted that, as Lindsay talked about in the beginning, that our rural communities and even our urban communities are having access to care that is reducing impact on jobs and time needing to take off from work and travel and all those other barriers that have made it more challenging in the past to have care and to have care maybe as frequently that match the needs.
Thank you. Now we do have an attendee question that was submitted before today. I think probably Alyssa or Lindsay is going to be able to best answer this. And this is the question. How can we make it so there are more slots available for the ID waiver? Or how can we add more waiver criteria so people with multiple mental illnesses can get some type of services to assist families in keeping them out of correctional services? So would either one of you be able to weigh in on that for us?
Do you want to take that one, Alyssa, or do you?
I'm no expert in the ID waiver, but I would imagine our IHH team does a lot with the ID waiver and helping patients and individuals get on the waiver list. And so that's a little bit outside of my area of expertise on this end. So I want to be really honest about that. But we know that oftentimes these issues come down to funding and availability of slots at current criteria. And those are big systems of care that can be hard to penetrate. And that is challenging. Absolutely. When we've got individuals on any of the waivers that are waiting a year or more to get the services that come as being able to be on the waivers. And so that really is a challenging impact. And then how do we utilize the care that's existing in the community to wrap around? And that's difficult. Absolutely. I don't have any hard and fast, real magic answers to that.
I think with a lot of things too, and even just, the piece of it with I think they had mentioned maybe the criminal justice system or the system at large. And that's always been the challenge is, and sometimes it goes all the way up to legislation and lobbying for more resources for mental health, especially here in Iowa. I think most recently, maybe my numbers are off a little bit, but I think we're like 46th in the nation as far as mental health services and the accessibility and the effectiveness of that. And so Iowa has a long way to go, but being able to, you know, get everybody on the same page with understanding that, you know, if you're helping someone improve that piece of what's going on, so their mental health and some of those surrounding pieces, you're going to have less people in jail, less people in prisons, and there is some work being done around that too, which is good to see. But I think there's just still so much more that needs to be done. So.
All right, thank you guys. I hope that helped in answering the question. Is there anybody in attendance today that would like to ask a question here that feels comfortable in doing so? I just wanted to make sure that we opened up the forum for that. And that's okay too. I do want to get some final words from you guys. We said we'd wrap this up by 1 o'clock at the very latest. So for our panelists, first of all, thank you for your time today. Really appreciate it. Any final words from you guys? Anything we didn't touch upon today that you were really hoping we would? Just again, some final words. We'll start with Brooke.
I think the one thing that I was just thinking of that we didn't touch a whole lot on is the mental health wellness piece. I work with a lot of our families on trying to link them up with coping skills or just community involvement. So we did talk a little bit about the pandemic and how it brought about more loneliness and loss of connection. I think as a community that if we can support more programming around mental health wellness, so building connection and you know, just getting families outside and all the little things that help boost our mental health could really be effective in working with families and in our community. You know, the running groups and just what do we know that intrinsically helps our mental health that maybe we've even gotten away from between the pandemic and technology and teenagers on phones, and how can we bring community back a little bit more so that we're all naturally boosting our mental health wellness too.
Brooke, thank you. And thank you again for being here. And Troy?
That we talk about a lot when we go out into the community and hold events is for people to take these phones that are always in their hands and make sure that you have the suicide hotline and the text line in your phone. It's at a time of crisis, you'd be surprised how many people can't remember those numbers. And I always just tell people, it may not be you that needs it, but it could be a friend. And at that time when it's every second counts, it's important that you have that number. I listened to a panel speak. It was a husband and a wife that lost their son. And one of the things in his note was he couldn't find the number to call anybody for help. So he decided that that was it. So I think it's important. I tell people I'm an advocate for mental health every day of my life, and I have those numbers in my phone because in that time of crisis, I don't know what I'll feel like. So I think that's important to put those numbers in your phone. You always have them available. And thank you for, again, having this and having me be part of it.
Yeah, thank you so much, Troy. I do see we have a question over here. And Alyssa, I'll direct the question to you. And then if you also want to give your final thoughts as well. It's, do you have advice on what to do if you think someone is suffering from some depression, but claims they are fine and they don't need help?
Yeah, I think really continuing to validate that it looks like, I noticed that. Having those kind of conversations, I noticed that it seems like you may be having a hard time with. How is it that I could best help you? Or what is it that you would need right now that could make a difference? Or, you know, those really kind of like, let's engage in this conversation. And sometimes it's a conversation we have a few times. It's not always the first time we bring it up where we identify it that someone says, yes, you're right. They may say, nope, I think I'm doing okay. And we say, okay, I'm here to help. if you need something. And then maybe again, we bring it up later when we notice other things, or things seem to still be, they seem to still be having a challenge. So we keep the door open to have that conversation. We provide that information and those resources. And obviously, if we've got someone who's having significant concerns, that we've got some safety issues happening here, then we reach out to law enforcement or other resources or National Suicide Prevention Lifeline, and we talk through what it is that's happening and how do we best help that individual. But really, we start with opening up to conversations, accepting that conversation, and normalizing being able to talk about it, and knowing what we do from there, saying thank you for your courage and sharing that with me. How can I best help you?
Thank you so much, Alyssa. Lindsay.
Yeah, I was just gonna say a couple things along those lines too. I know when some family members or concerned persons reach out and they say, you know, I really want to confront my loved one, but I'm just not sure how to do it. In that aspect, like in your personal life, wanting to talk with someone that you care about concerns, I always encourage people. I think it's always best received when you start off with giving really specific examples of what you're seeing that's concerning, and then telling them how it's making you feel. So instead of pointing the finger at them and saying, you know, like, you have a problem, you need help, this is what you need to do, this is what's wrong, just sharing how concerned you are or how scared you are for them or whatever it is that you're feeling, so that they don't feel attacked. Because again, this is a topic where as soon as it's brought up, you know, a person wants to throw up their defenses right away. You know, I don't have a problem, everybody else has a problem. And you know, because maybe they're still kind of not to the point where they can see that there is an issue. As far as any final thoughts, I know self-care is also a hot topic, and you know, we kind of touched on that a little bit ago, but I think it's interesting. I've never really loved the term self-care, because it implies that you and you alone are totally in charge of making sure that you're okay. And I'm a big believer in community and the need for that interaction. And that's part of the reason why the pandemic has been so difficult, is because we are hardwired to need that connection with each other. And so just encouraging people to build up their support system in any way, shape, or form that they can, reaching out. You know, I just say, if you can get as many people in your corner as possible, like, you can never have too many people, because at any point in time, you know, some of those people might not be available to reach out to. So the more you have to choose from, the better off you're going to be. And so I think that that's also, you know, in terms of our self-care, making sure that it's not just ourselves, you know, that we're part of a group or a community, and that we're actively engaging with those people.
Lindsay, thank you very much. And finally, Pam.
Thank you again for the opportunity to be here. Two things and ask. So I want to thank people that have given generously to causes supporting mental health, and ask you to continue to be really generous to United Way and Alive and Running and all of the good work that is supporting these services in the Cedar Valley. Also, you know, as part of that ask is encourage young people to join and to, you know, to help and go into the profession. We are doing what we can really to support college students, paying their way, paid cohort of 4 students to go become nurse practitioners in psychiatric mental health. So just encouraging people to seek careers in this area will be very helpful to the Cedar Valley as well. And then finally, a resource, really. I talked a little bit about making it okay. Health Partners in Minnesota came up with a very impactful program called Make It Okay. And that resource is at makeitokay.org, but it gives you all of the, you know, if words matter, it gives you all the ways that you can have that conversation, things you should say, things you shouldn't say. So, you know, I've taken a lot of notes listening to my fellow panelists today about how they have those conversations, but a great resource and easy to find. So thank you.
All right, Pam, thank you so much. And if there are no other questions, I can see that Sam is putting the resources there on the chat if you want to see those. But this does bring us to the end of today's Lunch and Learn. And thank you so much, of course, for attending. The Cedar Valley Women United hope that you learned some new information and that they're going to be sending out those resources as well. And this amount of people attending today really shows how important this topic of mental health is, and that our Cedar Valley community is strong and saying that no one is alone. So again, thank you guys, everyone, for your time today. And I hope you have a great weekend. Thank you.